Hi, I'm Dr. Sridhar K. There were a few requests from some of you on showing you how to console a baby who is upset or crying. There are two scenarios. It may be helping the parents who are watching this video. It may also be helping the young doctors who are asked this question in the exam, or if they get a baby that they have to console and examine. So babies cry for various reasons. So they may be crying because they're hungry. It may be crying because it's too cold in the environment. You're undressing the baby, and they may be upset for various reasons, like a nappy which needs changing. They might have pooped in it. So it's very important before you jump in to know why the baby is crying. So if the baby is due a feed, you feed them. I've discussed in many videos before on not to overfeed babies, so don't overinterpret cues. If the baby is not due a feed, look at other factors like changing the nappy. You can use a pacifier after the first 3 weeks of age if you intend to use one. It's not essential, but if you choose to use one, you can use a pacifier. But use it only when the baby is restless or crying. Don't use it to keep the baby calm or quiet all the time, because the babies get used to it, and sometimes its effect wears off as well. During the first 2 weeks, we don't recommend using it, as it may interfere with establishing the latch. So a parent who is well experienced, where the baby has latched well in the first few days, may decide to use it, but these are exceptional situations. The posture in which you can hold a crying baby to calm them down is almost like resembling the way the fetus is, and I'll be using this little doll to demonstrate. So basically, support the back of the neck with the upper back and flex the legs almost approaching the fetal position. Hold your other hand under the buttock of the baby, and gentle rocking and or to and fro movements help to calm down most babies. So the thigh is flexed against the tummy but not pressing on it. Your hand is against the bottom of the baby, and you're holding the upper part. Gently forward movements as well. So rocking back and forth tends to calm down most of the babies. You can even rotate the baby gently. No firm rocking movements, no shaking at all. And gentle calm voice. You can soothe the baby by talking to the baby, or even continue speaking to the parents. It works most of the time. Of course, if the baby is upset due to injection or pain or something, it may not work, but it works in most of the situations that I have faced in the clinic. Stay calm, use a calm voice and gentle movements, as I told you. Parents can use that at home as well. Be clear that you shouldn't shake the baby for vigorously. There is a risk of bleeding in the brain or in the eyes with such movements, and this is why the term battered baby comes from. Shaking vigorously or rocking the baby can even lead to a bleed in the subdural space of the brain. So gentle rocking movements, rotating. Um, some people take the baby for a drive, but that's not necessary. You can walk around in the home holding the baby in this position. Make sure the environment is comfortable as well. And remember, babies have different moods and they may not want to sleep when you are sleepy. When our sleep is disturbed, we get more upset. So if the same baby is crying in the day, we don't get as upset as if the baby is crying in the middle of our sleep. Have a regular feeding pattern, avoid overfeeding. Feeding the baby extra to make the baby sleep longer doesn't work, and it's not a good way to train the baby satiety as well. I hope this short video is useful, and please do share. If you have any thoughts or suggestions yourself, please mention in the comments below. Thank you.